Thomas Eric Duncan died today in a Dallas hospital, the first death from Ebola in the United States. Duncan, who was 42, was visiting from West Africa where he caught the disease and where 3,900 people have died of it. Late today, a Dallas County Sheriff's deputy who'd been in the apartment where Duncan had stayed was admitted to a hospital. He has flu-like symptoms, could be anything, but Ebola tests are being done. We have a team of correspondents covering this developing story. First, we'll go to Manuel Bojorquez in Dallas.
This ambulance rushed the deputy to Texas Health Presbyterian Hospital this afternoon. He was brought here after seeking treatment at an urgent care center in the Dallas suburb of Frisco, where Mark Pylant is the fire chief.
This patient had reported that they initially had been in the apartment and the initial Ebola patient in Dallas and had some contact with family members.
Pylant says the unidentified deputy is being evaluated out of an abundance of caution and is not on the list of those being currently monitored for possible contact with Thomas Eric Duncan. He is in the same hospital where hours earlier Duncan died. Pastor George Mason delivered the news to Duncan's girlfriend, who is quarantined.
It was a painful and difficult time for her. She reacted as almost anyone would, with great shock and despair.
Duncan's case exposed serious flaws in the Dallas healthcare system. The hospital released him when he first showed up with a fever and stomach pains, even though he told a nurse he'd come from West Africa. He returned 2 days later by ambulance, but had possibly exposed others. Duncan's girlfriend, Louise Stroh, now questions whether treatments, including an experimental drug, came too late. In a statement, she said, "I trust a thorough examination will take place regarding all aspects of his care."
She expressed all the what-ifs. Oh, you know, what if they had taken him right away? And what if they had been able to get the treatment to him earlier?
Thomas Frieden is director of the Centers for Disease Control and Prevention.
One of the things that we're working hard to promote now is ensuring that doctors and nurses, pharmacists, healthcare workers throughout the healthcare system think Ebola in anyone who has fever and ask whether they have been in West Africa in the past 21 days.
Duncan's body remains contagious. Today, the state health department said it would follow CDC guidelines for handling the remains, which include cremation. Scott, test results on the deputy being evaluated here are expected within the next 48 hours, though officials believe his risk is low.
Manuel Bojorquez. Manuel, thanks very much.